All right, so are you ready to dive into some healthcare talk in English today?
Sounds good to me.
Okay, perfect. So we got this English language lesson from a listener,
Oh, cool.
and it's all about like navigating those tricky conversations you might have, in a doctor's office or a hospital,
Right.
but in English.
Yeah.
So we're going to go beyond just like the basic vocab and really get into the cultural stuff too, because that can be honestly the hardest part sometimes.
For sure, for sure. Even if your English is pretty good, dealing with healthcare in another country, that can feel like a whole different language sometimes.
Totally. So this lesson, it jumps right in with this real-life dialogue between a doctor and a patient.
Oh, I like that. That's always helpful.
Yeah, it is. And it's funny, one of the first things that stood out to me was the doctor checking the patient's lymph nodes.
Oh, interesting.
Yeah. I mean, honestly, I don't know if I would have even thought of that during, like, a regular checkup.
Right, right. And that's a good reminder that what doctors do, like their actual practices, can be so different, even in different English-speaking countries.
It's true. It's true. And speaking of differences, did you catch that little detail about a prescription fee in the UK?
Ah, yes.
That, to me, is like a little clue about how healthcare systems can be so different.
Oh, absolutely. Like in a system with insurance or a national healthcare plan, you wouldn't see that.
Exactly. Exactly. It's a tiny detail, but it tells you a lot.
Yeah.
But okay, what if you're like totally new to a country and you don't even know where to start? Like, how do you even see a doctor?
Right. Yeah, that's a big one. Well, luckily, this lesson actually tackles that head on. It compares, the public healthcare system to the private one.
Okay, interesting.
So the UK system, it's mostly free, which sounds amazing.
Right.
But there's the potential for those long wait times. And for some people, that can be a deal breaker.
Oh, yeah, especially if you're used to a private system where, yeah, you pay, but things tend to move faster.
Exactly. And then there's this whole concept of registering with a GP in the UK. I bet that's something a lot of people listening might not be familiar with.
Yeah, yeah. I mean, it's like having this one doctor who's kind of your entry point to everything.
It is. It is. They're like the gatekeepers,
Yeah.
And this lesson really emphasizes how important it is to understand these kinds of like entry points, because otherwise it's like wandering through a maze blindfolded.
Oh, for sure. And then just when you think you've got a handle on things, the lesson throws in a curveball. So it tells this story about a friend who suddenly ends up in the hospital.
Oh, wow. Okay.
Yeah. So suddenly we're dealing with a whole new set of vocabulary, a whole new environment.
Right, right. Of course.
Yeah.
More intense, too.
Absolutely. So now we're talking about A&E.
A&E.
Yeah. Which stands for Accident and Emergency, the UK term. Basically what we would call the ER here.
The ER. Got it.
Exactly.
Yeah.
And the lesson doesn't just throw around like complicated medical jargon.
Yeah.
It gives you phrases you would actually hear in that situation, like keeping him in, meaning the patient has to stay at the hospital.
Oh, that makes sense.
Or visiting hours, when you can go see someone.
Right, right. The practical stuff.
Exactly. And it also kind of sneaks in the difference between inpatient and outpatient care.
Okay, yeah. For those who aren't familiar, inpatient means you stay overnight, and outpatient means you go home the same day.
Exactly. It's all woven into this, like, realistic story.
Yeah.
Which is cool. I actually found myself, like, imagining being in that hospital waiting room.
I can see that. It's really well done.
It is. And, it's not all just practical stuff. The lesson touches on the emotional side, too. Like, it mentions the patient feeling fragile after surgery.
Yeah, it's a good word for it, that feeling of vulnerability you have after being sick or having a procedure.
Exactly. And that desire to get back to normal, which I think we can all relate to.
Oh, definitely. Definitely. But what I appreciate is that the lesson doesn't just give you the vocabulary. It shows you how to express those feelings in a way that's culturally appropriate.
Right. That's huge.
Because sometimes it's not just about knowing the medical terms. It's about knowing how to, like, convey what you need and how you're feeling in a way that people will understand, especially in a healthcare setting where things can be so, well, sensitive.
Absolutely.
Yeah.
And there was this one phrase that really stuck with me. One day at a time.
Oh, yeah, that's a good one.
It's such simple advice, but so powerful.
It really is. And it applies to so much more than just recovering from illness. It's about, being patient with yourself, focusing on what you can control right now.
Totally. And what's interesting is how the lesson kind of nudges you to think beyond just the immediate situation.
It does. It does. Like it's saying, okay, we've talked about this specific example, but now think about your own experiences.
Yeah. Like how does healthcare communication work in your culture?
Right. What are the differences? What are the similarities?
It's like this little invitation to compare and contrast. And honestly, this whole lesson, it's not just about learning English. It's about understanding healthcare in a much deeper way.
It is. It is. It's about the culture, the communication, the whole experience. It's pretty cool.
Yeah, it really is. So welcome back to our deep dive into healthcare talk in English. We're still going strong with this lesson, and I gotta say, it just keeps getting better and better. One thing that really struck me in this part is how smoothly it brings in all this practical info about, like, medications.
Oh, yeah.
Yeah, it's not just like a boring list of terms. It mentions those everyday painkillers, you know, like paracetamol and ibuprofen.
Right.
But then it points out that even those, sometimes a doctor might actually prescribe them.
Huh. Yeah, that's true.
And it's like, oh yeah, those are anti-inflammatories too.
Yeah.
I mean, I knew that, but it's a good reminder that they help with, fever and swelling.
Okay.
It's like a little mini lesson on those over-the-counter meds tucked right into this bigger lesson.
I like that. I like that. Sneaking in those little extras.
Yeah, exactly. And then it goes even further. It gives you these useful phrases for, like, how to actually take the medication. Stuff like take one pill every 12 hours, or make sure you take the pills with food.
Those are so important.
I know, right? That's what you'd hear from a doctor or a pharmacist. It just shows you, again, how clear communication is, like everything in healthcare. And of course, there's the classic warning about not drinking alcohol with certain medications.
Oh, yeah, that's a big one. Mixing those two can be, well, a recipe for disaster.
For sure, for sure. But what I thought was really helpful was how to explain the difference between pharmacy and chemists.
Oh, right.
They mean the same thing in British English, but someone learning English might not know that.
Yeah, it's easy to forget how many little regional differences there are.
Totally. But what really got me thinking was how this lesson, it kind of zooms out from just the vocabulary and those specific situations and starts asking bigger questions about, like, healthcare systems in general.
Oh, interesting.
Yeah, like, it contrasts the UK system, which is mostly free and public, with systems that rely more on private insurance.
Yeah. That's such a complex issue.
I know, right? It really gets you thinking about the pros and cons of each one.
Public healthcare, you get that wide access, but maybe longer wait times. Private insurance, you get more choices, things move faster, but then there's that cost factor.
Exactly. It's not an easy thing to solve. But this lesson, it encourages you to think about those different models, how they work, and how they affect people all over the world.
I like how it gets you thinking beyond just the lesson itself.
Me too.
Yeah.
And then it takes it even a step further. It asks you to think about healthcare in your own culture.
Oh, that's smart.
It is.
Yeah.
It's like it's saying, okay, you've seen how things are done in this one place, but now let's look at where you come from.
I see. So, like, how do people usually get healthcare where you live? Do they go straight to a specialist, or is there like a primary care doctor who kind of guides them?
Exactly. And how does the whole money part work? Is there like national health insurance, or do people rely on private insurance?
It's interesting to think about. We might not even question those things in our own cultures, but then you see a different system and it's like, whoa, there's a whole other way of doing things.
It is. It is. And that brings us right back to why clear communication is so important.
Yeah, for sure.
This lesson gives some great examples of how to explain your symptoms in a way that's really clear and easy to understand. I especially liked how it pointed out that we use the present perfect tense for things that keep happening, like I've been having stomach problems.
Right.
And then for something that's more stable, we use the simple present, like I have a rash on my arm.
They might seem like small grammar things, but it makes a difference when you're trying to tell a doctor what's wrong.
Oh, huge.
Yeah.
And this lesson doesn't shy away from tougher stuff either. Like it has an example of someone needing surgery.
Okay, so more serious medical talk.
Yeah. It introduces words like incision, which is the cut they make during surgery, and wound, which is, the injury that has to heal.
Right, the basic stuff.
And then it even mentions an ECG, which is short for electrocardiogram.
Wow, so it gets pretty in-depth.
It does. It's like it covers everything from everyday aches and pains to, like, more complicated procedures.
That's impressive. It's like a crash course in healthcare vocab, but in a way that's actually interesting and engaging.
Exactly. It's not just about the words. It's about connecting those words to real-life situations, different cultures, and, those feelings we all have when we're dealing with health stuff.
That's what makes this lesson so cool, I think. It's about more than just learning English. It's about understanding what it means to be human, especially when you're facing health challenges.
Yeah, I totally agree. Okay, so here we are, back for the last part of our deep dive into all things healthcare and English. And wow, this lesson has really been something else, wouldn't you say?
Oh, it really has. I mean, we've covered so much ground from just basic checkups to serious procedures and all with this layer of cultural insights and little language things you might not even think about.
I feel like we started out maybe a bit lost, like how to even talk about healthcare in English. And now we've got like this whole toolbox of phrases and, just a better sense of how things work in different cultures.
Exactly, exactly. And that's what's so great about this lesson. It's not just about vocabulary, it's about giving you the confidence to communicate in situations that can be, honestly, pretty stressful,
Hmm.
especially when you're dealing with health stuff and you're in a whole different culture.
It's so true. It's like almost like having a secret code book to understand the language and the customs of healthcare in English-speaking countries. But even beyond just the practical stuff, this lesson has really made me think about things in a new way.
Me too, me too. I think that's what makes it so valuable. It's not just surface level, like, here are some words. It makes you think about healthcare systems, the differences between cultures, and just the whole human experience of being healthy and being sick.
It really does. It's like opening a window to all these different ways of looking at things. And it's made me realize that even simple phrases like visiting hours or keeping him in, they come with all these cultural ideas and expectations that we might not even realize.
That's so true. And that's why it's important to be aware of them because, miscommunication in a healthcare setting, it can be a big deal.
Absolutely. But now I'm curious, what was the biggest surprise for you in this lesson? Like what really stood out as, insightful or maybe even unexpected?
That's a good question. I think for me, it was realizing that healthcare communication is about so much more than just the medical terms. It's about understanding the culture, being able to say what you need and how you're feeling in a way that's clear, and, just being aware of how to communicate when things are maybe a bit more sensitive.
That's so well put. It's about like bridging that gap between cultures and languages to make sure everyone's on the same page. And this lesson, I think it does a really amazing job of showing us those challenges and giving us tools to deal with them.
I agree. I agree. But before we wrap up, I want to leave you with something to think about. We've looked at all this through the lens of this English lesson, but what about your own culture? How do these same ideas play out?
That's a great point. Think about like how do people usually access healthcare where you're from? Do they go straight to a specialist or is there like a main doctor who refers them?
Right, right. And then how does it work with the costs? Is there a national health insurance system or is it more private?
And even beyond that, just think about how people talk about health and illness in your culture. Are they very direct or is it more, subtle?
Those are great questions, and they really show how much we can learn from comparing our own experiences with how things are done in other places. So keep those in mind as you keep learning English and keep navigating the world of healthcare wherever you are.
I love that. And speaking of navigating, remember, clear communications is key, not just in healthcare, but in life in general. So keep those conversations going, stay curious, and of course, stay healthy.
Couldn't have said it better myself.
Well, that about wraps up our deep dive into healthcare communication in English. Thanks for joining us. We hope you found it as interesting and, thought-provoking as we did.
Yes, absolutely. And until next time, keep exploring, keep learning, and keep those connections strong.